Assalamu alaikum viewers. I'm back with another video. Our today's topic of video is diverticular disease, and my name is Amna Mahmood and I'm a registered pharmacist. Let's get started. Diverticular disease is a bowel disorder and it normally affects your large intestine. Diverticular disease is caused by small bulges in large intestine known as diverticula developing and becoming inflamed. As you can see in the diagram, the small bulging pouches, these are known as diverticula. Let's discuss diverticulosis versus diverticulitis. In diverticulosis, there is a formation of abnormal pouches in the bowel wall, and in diverticulitis, it's the inflammation or infection of these abnormal pouches. Diverticulosis leads to diverticulitis in out of 5 cases, which is more serious. As you can see in the diagram, these abnormal pouches is diverticulosis, and when these pouches get inflamed and get swelled, you can see in this diagram. So these are known as diverticulitis. And because of the infection, diverticulitis is more serious than diverticulosis. And in diverticulitis, we have further two conditions in which acute diverticulitis and complicated acute diverticulitis. When diverticulum suddenly become inflamed or infected, it's acute diverticulitis. And when it is associated with complications such as abscess, bowel perforation, then it is known as complicated acute diverticulitis. What is the aim of our treatment? Let's discuss it. For relief symptoms, improve quality of life, manage episode of acute diverticulitis, and to reduce the risk of recurrence and complication. Symptoms such as abdominal pain, fever. So these are some aspects that we need to focus on when we are deciding what would be our treatment plan for that patient. Firstly, we're going to discuss the non-drug treatment. The patient needs to take a healthy, balanced diet. And in healthy balanced diet, we have whole grains, fruits, and vegetables. Let's discuss the drug treatment. Drugs that relieve symptoms of diverticular disease include painkillers such as paracetamol, bulk-forming laxatives for constipation and diarrhea, medicines to help with stomach cramps, antispasmodics, antibiotics if the diverticulitis is caused by an infection. And the generic paracetamol, there are so many brands that are available in market, but the most popular is Panadol from the GSK and paracetamol from Pfizer. In laxative, we have Fibogel, Aspergol husk, the most commonly used, then methyl cellulose, psyllium, which is also known as metamucil, and polycarbophil, which is also known as fibercon. These are some laxatives that we use for the relief of constipation. These are some bulk forming laxatives, including Aspergol husk, the product of Marhaba, then psyllium husk, and metamucil. In antispasmodics, we have Spasfone and Anafortan, which is available in injection form, and also we have Clofec, that also relieve in abdominal pain, and also we have Zespa. Antispasmodic actually relieve the spasm and cramps and also relieve the abdominal pain. Then we have antibiotics that we give if the condition is because of any bacterial infection. Antibiotics are used to treat or prevent some types of bacterial infection. They work by killing bacteria or preventing them from spreading. Here we have Augmentin. It's a combination product of amoxicillin and galvanic acid. Then we have Z-Cef, Calflex, and Cefspan. Then we have Bactrim, which is a combination product of sulfamethoxazole plus trimethoprim. There are some drugs that increase the risk of diverticulitis, including steroids, opioids, Non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Motrin IB, naproxen sodium. This is all about our today's video. For further information, read the NICE clinical guideline. Thank you so much for watching. If you like my video, please give us a thumbs up and subscribe to my channel. Bye.